In Ontario, visits to emergency departments have increased at more than double the rate of population growth, and people are coming in sicker than before. We know that once admitted, more and more beds are occupied by patients waiting for care elsewhere. Across Ontario, we have data that demonstrates that seniors in long-term care homes are older and more frail than any other cohort in the province's history. Further to this, we recognise that our population is ageing. Provincial estimates indicate that over the next 10 years, Ontario will have 50% more seniors over the age of 75. In this rapidly changing environment, we know that it is increasingly important to understand how our residents and seniors transition between care settings. At Northland Pointe, similar to long-term care homes across the province, we became particularly concerned with the number of potentially avoidable transfers of residents from our home to emergency departments, and the avoidable reoccurring transfers within a 24 or 48-hour period. We understood that the cost to our residents' physical and mental health were serious. Long stays in emergency departments can result in patient suffering, poor patient outcomes, poor quality of care, and an increased risk of medical error, and contribute to infectious disease outbreaks. For seniors, the risks due to overlong stays in hospitals can be even worse. Financially, avoidable transfers and reoccurring transfers had implications for both our residents and for our healthcare system as a whole. Costs for our residents and to the system could range anywhere from $45 to over $1,300. A disconnect between our long-term care home and Niagara region's emergency departments was also felt by our staff. Poor communication and a lack of understanding resulted in a culture of distrust between staff. Often our clients were caught in the middle. In recognizing how both long-term care and acute care are struggling to meet the heightened demand of patients with generally higher acuity, we decided to take action and implement a person-centered approach to transitions in care. To achieve this, we reached out and developed relationships with our long-term care homes, the 32 other homes in the Niagara region, 3 emergency departments, and between our long-term care homes and our residents' families. We provided long-term and acute care staff with tools to share information, standardized processes related to residents' transfers between settings, and strengthened our capacity within to provide acute care. Our approach, based on collaboration between partners in healthcare, has strived to improve health outcomes for our residents, establish mutual respect and cooperation between staff, and ensure that transfers are completed with the highest standard of care in mind. When we work together to put our residents first, we improve the quality of care for our seniors in the community.